If you're going to do Botox for patients with really deep crow's feet, you have to know about this. It's amazing. We get patients sometimes where they have really, really deep crow's feet. Their skin may not be quite as healthy, or maybe they haven't done this and they're jumping into the game late. And so you can get all the muscle of the orbicularis oculi paralyzed, and they come back and it's better, but they still have significant etch lines.
Yeah, like I still have lines. We're not seeing those lines with movement anymore.
There's no movement whatsoever, right?
But the lines are still there.
Yeah. So in those cases, and sometimes we do it ahead of time, I use Meso mix. Tell them about that.
Meso mix, it's a blend, and it's two things you might not really think about blending together, but it's Botox and a very light filler. We typically use
And blending means putting them in the same...
Putting them together.
Yeah, mixing and matching. A little witchcraft there, but it works beautifully. As the injector, you want to assess, well, how much Botox would I use here? You know, is it 10 units? Have I treated it before? So if it's not something you've treated and you're treating it for the first time, and you say, I would, normally use 10 units, maybe 12, then you take out 12 units, and then you use a very low G prime filler, a very light filler, and you actually blend it 1-to-1. So for instance, we use a lot of Allergan. We'll use Volbella, and we'll blend it with 1% lidocaine in a 1-to-1 ratio. Mm-hmm. And then we take the top of the BD syringe off. We carefully drip in 12 units of Botox, put the syringe back, use a mixer, and make this magic Meso mix. And then you take a 27 gauge cannula. There are really no major vessels you have to worry about this because you're going to be so superficial. Let's say the lines are extending here this way. I like to introduce my cannula here. There's just superficial on the skin here with a moving cannula. There's no absolute safe spot, but that's pretty safe. And what you do is you insert the 27 gauge cannula, and the first thing you do is just very gently subsize. You're releasing the skin, and we've seen cases when they're really deep, that alone before you inject the filler is actually doing a lot. Mm-hmm. So you subsize. If for some reason the cannula is not gliding, you're not in the right place, okay? Very superficial. That should glide very easily. Now you'll run into little speed bumps. You're freeing up the skin. Then once you do that, you just bring some threads of this very fine filler, very, very little bits, small amounts. And then when you're done doing small amounts, you use your finger or a tool, massage tool, and you really blend it in. You tell the patients it may be a little protruding for first 12 hours or so, and then it will subside as things get absorbed. You don't want to overdo here. Mm-hmm. But what that does is you're creating a potential space, putting down this jelly-like substance of filler between the muscle and the skin. The beauty of that is the outward appearance of the skin already looks better, less lines. The muscle is not creasing on the skin, and it is, even when the muscle starts to wake up, it is much less likely to cause the same severity of those lines because you've created that little barrier. Mm-hmm. The other thing is, we have seen this last 6 months on patients. Somehow the Botox seems to make the filler last longer, and the filler makes the Botox last longer. It's synergistic. So using the Meso mix for deep crow's feet is really, really effective. Of course, you never want to oversell, but when you are faced with a patient with really, really deep lines, or if you have a patient who comes back and the lines are still there, there's no movement, for the future, you can do it all in one fell swoop. Highly recommend this tip. We've seen huge changes from that.